Integrated health, interactive live stream.
Integrative health, interactive live stream. Well, I want to welcome everyone. If I stand up, Blake, can you get me standing or sitting?
Perfect.
Okay, good. So half the time I'll stand, half the time I'll sit. And the purpose of these gatherings is, and now we have it on live stream, so we might have another 30 or 50 online, hopefully. We had a good number last time, Blake.
Yeah, almost 100.
All right. So the purpose of these live streams is to create awareness for our patient base at Tustin Longevity Center. It's a venue where I like to have an audience here. And for those who are on the internet world, hello and welcome. Thank you for joining in. But we also have 15 or 20 people here as a live audience as well. That way, as we go through the questions, as we talk about today's topic, with which you all chose, okay, and we'll elect what topic we want for next month, I can get questions from you. And I believe that the audio was good enough on the internet last time that you could actually hear the questions pretty good.
As long as they're presented loudly.
As long as you speak your question loudly, this is pretty well picked up. Also on the internet, we have a live stream going on right now for the people watching out in the internet world, and they can type in questions as well. One of the things we thought as doctors at our monthly doctor-clinician meeting here, the 5 of us doctors decided that I am going to do this one today and then the next one in August. Come September, Dr. Merrick is going to be in my seat here. And I believe her topic already, she really predetermined is going to be hormones and why we shouldn't be afraid of them. There's too much fear. She wants to dispel the fear of natural hormone replacement therapy. So that'll be the September seminar. So yes, we want to ask you what you want to do, but that's what she has a passion about. We always do this on the second Thursday of the month, unless some big event coincides on it. Thanksgiving is the 3rd, right? Thursday of November. Okay, all right. And so as we're going through these questions, and I'm going to pass these out to you right now, so I'm going to leave you in the internet world, but Blake, here, I don't know if we can ever get this on the internet.
We will be able to.
We will in the future? Yeah. So do you mind passing them out to everyone? Okay, thank you. See how nice my patients are? They work for me without pay. And what we're going to do is we're going to work through these questions. Those of you who have been coming here, or those of you in the internet world who have been coming here, because we were jam-packed, we couldn't fit any more people in here before. We go through a question, and the question generates our interactive responses. I don't want you to think that I'm coming up here with a lecture. That's not what this is about, okay? What this is I'm a general practitioner. For those of you who don't know me, I'm Dr. Ellithorpe with Tustin Longevity Center. And when you come in the office, many times we would like to talk to you even more. We would like to entertain your questions even more. And so we have decided these monthly seminars are a venue for you to get to know us, or if you had more questions from your visit, somewhat structured, but we're trying to make ourselves available to you. We're not trying to say we know everything. As a general practitioner, I have a vast, almost 40-year experience in integrative alternative medicine, my dad being in food research with Armor Foods. So in food research, are we looking for the bathroom or for stuff? All right, just for housekeeping, we have a bathroom right here to your left. And if you go out the front door area and turn to your left, there's a second bathroom there. So that's all the housekeeping.
So and there's water as well.
The water's back that way?
Yeah, the water's back this way as well.
Thank you, I'm sorry for the.
No, this is casual. All right, so here we are. We have our questions. Please pipe in and ask questions about it, generate a discussion, and we usually have a good lively old time when we do this, okay? So I'm going to go ahead and sit down unless that bothers you. If you people want me to stand, raise your hand and just say, get up, okay? All right, but I've been up since 5 this morning, did my workout at 6:30, and so I haven't had any sleep for a long time already, or any rest, or any lunch break. All right. Huh? Good night. There you go. So do you want to read the questions off, Blake?
It picks you up much better.
It does?
There's most of it.
Okay, all right. I'll read the question off. And our doctors are on the internet. They're live. And when you type something in, for the people who are in the internet world, if they put something in the chat space, maybe Dr. Kaur, Dr. Mitchell is still working and seeing patients, maybe Dr. Merrick or P.A. Patel, they will be chiming in, or my nurse, Linda, all right? So they might help me answer questions. All right, so today's topic by popular demand was, let's talk about joint and arthritis. It's titled Arthritis, Joint Aging and Breakdown. Arthritis, joint aging and breakdown. Now, am I sitting here and representing to you that I'm a rheumatologist or I'm an orthopedic surgeon? No, I'm not representing to you that I'm a specialist in this. Rather, what I'm trying to say is, as a general practitioner, I see patients with this problem every day of my life. And so I have a boatload of experience and outcomes that are quite exciting, I believe. And some of my patients here would probably want, if they feel comfortable sharing some of their experiences and successes, we welcome it, but you don't have to. All right, so question number 1 is, the vast majority of people suffering from pain of arthritis can help themselves by blank. What's the answer? What do you think the answer is to question number 1? The vast majority of every human being that suffers with the pain of arthritis can help themselves by doing what?
Diet.
And so you're saying
Diet.
your diet?
Food choices.
Food choices. Any other responses?
Exercise.
Exercise?
THC.
Yes, cannabis. Any other suggestions? Helping yourselves.
Drinking water.
Drinking water, yes. You guys are great patients. I can tell you for coming here. So over the years, and when I listen, and of course in preparation for this, I must have sat between the past 2 weeks listening on YouTube to maybe 18 hours of lecture from various orthopedic surgeons, from leading name alternative or integrative physicians like Dr. Schallenberger with ozone therapy. How many of you have ever heard of Dr. Schallenberger and his great work with ozone therapy? About two out of the 20 of you, okay. So I've been looking at this, but I also listened to the various organizations. You know, Australia has its medical department of arthritides, rheumatidities, you know, any joint inflammatory and degenerative breakdown organization. Just like there's the American Heart Association, there's the American osteoarthritis or joint inflammatory associations. So I've listened to these people, and one thing that I find very interesting is many of the orthopedic surgeons and rheumatologists will begin their lecture on arthritis going straight to anatomy, and we'll discuss that a little bit here. How many understand what arthritis means in general? Everyone has an understanding. Arthritis, itis is inflammation, arthro is the joint. So any joint pain or problem. And there's many kinds of joints and different kinds of joints. You have joints in your head, on the skull. Now, at my age, 65, mine are fused, okay? But in a toddler and a newborn, and young child, these joints in your skull, sutures, are not fused, okay? And there's a special kind of cartilage in your skull that will get solidified, okay? There are cartilages and joints that are immobile like this, okay, in me right now. There are slightly mobile joints, very minimal motion, and those are in places more like there are certain parts between your ulna and radius bone here that they don't move very much, okay, in here. So we have slightly movable joints. There's some in your spine. And then we have the very obvious motion-filled joints like your knee joint, your arms, your shoulders. These are, the ones that we're all largely talking about. And there's different kinds of connective tissue involved. A cartilage surface will have, like in your knee, haline cartilage, but the cartilage between your vertebra will have more of a fibrous type cartilage, okay? And even in the center, it'll be more mushy. That's another different kind of cartilage. So the cartilage is different. So the term arthritis, and our topic is arthritis, joint pain, and breakdown, is addressing all of these. In your pelvis, you have two bones. In your pelvis, you have the symphysis pubis right here, okay? And women, when we're pregnant, that softens up a little bit, okay? You have the joints between your sacrum and your iliac wings here, okay? And you wouldn't think there's much movement there, but they are still a joint, okay? And they have a cartilage between them. So we have joints of various mobility, joints with different cartilage, and a joint that has a capsule is probably the kind of joint that most of you are much familiar with, like your knee. And I have this little handout. I'm going to ask to, can we do that too? And so since this is on the internet, I am going to, I think I'll wait until everyone gets a copy. So these joints that have capsules are typically the ones that have the most motion, okay? And these capsules contain a fluid, and this fluid is synovium. And it's I thought one clever orthopedic surgeon referred to the fluid in your knee joint, the synovial fluid, as joint urine. Literally. It's a distillate of the capillaries that are in the synovium, just like you get a distillate in the capillaries of your kidneys into the collecting renal pelvis to your bladder, which is urine. Well, even in your joint, you have capillaries in the synovium of the capsule. Now, can you see? All of you now have this. Let me make sure I'm oriented up and right. So how many of you can see this red area lining the joint? Can you all see that? All right, and you can see the arrow there I wrote is the synovial joint, right? The synovium, the synovial membrane. And if I did a biopsy of that membrane and I put it under a microscope, you would see that there's many capillaries, okay? Capillaries in this red membrane. This red membrane called the synovium. And this red membrane will actually allow you to filter the blood in the capillaries, and it will secrete into the joint, and it will be reabsorbed. And there should be a constant homeostasis of the joint fluid. Okay, everyone with me on that point? But not all joints have a capsule and a synovium. And we pointed to the sutures in my head here on our skulls. That's one that certainly doesn't have that, right? Okay. You could say the articular surface of your spine is another one that really doesn't have a capsule, your vertebra there, okay? It's semi-mobile, okay? But it's not as mobile as my shoulder, okay? I know there's some contortionists that have certain elastase problems. So what we want to be talking about when we think of the joint and these membranes is how they get injured and how they heal themselves, all right? So when I talk with these orthopedic surgeons, or I listen to their lectures, or I listen to the rheumatologists, very rarely will I ever hear any of them say, you need to lose weight. You know, you're coming in with knee pain or ankle pain or your arch in your foot pain, or you're having low back pain, okay? Or you're a woman very, very heavy and you have a huge bosom and you're being pulled forward, okay? You very rarely hear your physician say, you need to lose weight. And do you know what they said on the lectures? They said, because that's not our job, okay? We don't have the time in a 7-minute visit to address weight loss, all right? Can you all kind of connect with that? So by the time you're referred to an orthopedic surgeon or a rheumatologist, it is assumed in the ether that you have already decided you're not going to do a lick. You're not going to do anything to try and lose weight, all right? And you're already coming to interventional prescription, pharmaceutical, invasive, and to the end point, total hip or total knee or back surgery. That's how they see you coming to their office. Do you see what I'm saying? And yet, if you look at research regarding what are the major methods that have procured for the patient pain relief, restoration of functionality, joint stability and strength, using it again. Along with that, the mood of the patient goes up. The productivity and the well-being of the patient goes up. What do you think one of 4 only research established things is well documented to improve chronic degenerative joint, the most common osteoarthritic problem that we face? And it's a huge problem. I don't have the stats off the top of my head, but how many of you know someone with joint pain? You know, we all do, yeah. So it's incredibly common problem. All right, so the question to you is, what one thing the vast majority of people suffering from the pain of arthritis can help themselves by? And the answer in research, and we're talking about multivariant, retrospective meta-analysis over decades, okay? We're talking somewhere in the realm of, 100 research published articles that are well done. And there's always challenges in doing orthopedic assessments, okay? I'll give you an example in a minute. But you want to know the answer. I can hear your heart saying, tell me what it is. It's weight loss. Dun, 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 dun. It is weight loss. Joints do better when you lose 10% of your body mass, okay? And you'll have about 4 pounds per square inch pressure relieved. That's significant. That's significant, okay? Now, how many times are you going to really get into a deep conversation with your orthopedic surgeon or your rheumatologist about the number one thing for all whether it's an osteoarthritis, which they probably improperly call wear and tear joint breakdown. It's just if you use your knees, you're gonna get osteoarthritis, And I see some of the more forward-thinking lecturers on this all seeing even osteoarthritis as a metabolic disease with inflammation as its core root, even in osteoarthritis. The vast majority of arthritides are that. Then there's the group of the inflammatory arthritides, okay? This would be your rheumatoid arthritis, your autoimmune, Reiter's syndrome, lupus, that even have other parts of the body, even some Crohn's or ulcerative colitis, inflammatory body diseases. Psoriatic arthritis has a skin manifestation of psoriatic skin lesions. So there's this inflammatory category of arthritis. And when you sit down with whether it's rheumatologist or orthopedic doctor, do you really think that they're going to talk to you about weight loss?
No.
No.
That they're going to know much about it? The audience here is saying no for the most part. And that's in a retrospective meta-analysis research over decades, looking at all therapies involved, okay? Whether you go from the off-label herbals, okay, acupuncture, Ayurvedic, fish oils, all these, interesting things, okay, to the, there is weight loss that is taught, okay, there is weight loss taught by them. They don't spend any time on it. Water, hydration. I had one of you answer water. Diet, there are studies on diet, talking about certain food groups that have a proclivity to promote inflammation and joint pain flare. But then you get into the prescription over-the-counter non-steroidals, and most of those used to be drugs anyway years ago. Then you have the more new non-steroidal anti-inflammatories. Then you have these cytokines, because we're learning so much about cell-to-cell communication, how if one cell is stressed, it can send out little chemical signals, okay? And those chemical signals recruit the attraction of white blood cells, blood vessel dilation, heat, increased blood flow, and hence you have pain, right? So these are called cytokines. There are arthritides that are associated with white blood cell antibody attack. And that's typically in things like the rheumatoid arthritis, but there are others, okay? And in all these kinds of cell-to-cell communication, we now have even drugs that are used both orally and self-injected or intravenously injected, like Remicade, Ibrance, stuff like that, oral. These are cytokine immune response modulating drugs, okay, as well. And then there's the PRP, platelet-rich plasma, ozone therapies injected. There's, debridement, arthroscopies. There's just even saline rinses of the knee. There's then partial and then complete joint replacements. So in the world of all of these options, and we included some of the forward-thinking red pepper, capsaicin topicals, and the oils, all the way to the knee replacement. This has been studied for the osteoarthritic, the inflammatory, and other traumatic diseases of the joints. And what do they find? There's 4 areas that really make a difference. Now, we'll see if I can remember all the 4. Okay, so, and what is one of them that is well established? This works. It is true across all the arthritides.
Weight loss.
Weight loss. Let's hear it one together.
Weight loss.
Yes. Okay. And so when you come to our clinic and you see our physicians, okay, we are going to try and take that time, okay? We're not going to do any 7-minute visit with you. And we're going to take the time to try and learn about you, what I can do to help understand your needs and motivate you, and become your coach, become your ally, become your friend, to help you in that walk to start facing weight loss, okay? So how long did it take us to do question number 1? All right, let's do question number 2. Is there a diet for people with arthritis? Number 2, is there a diet for people with arthritis?
Yes.
Yeah.
Say it, shout it out.
Yes.
Yes.
Yes?
Yes.
Okay. What's your idea of a diet?
Vegetable?
Vegetable?
Non-inflammatory foods.
Non-inflammatory foods?
Low carb.
Like what? Low carb?
Nuts.
Nuts?
No nightshades.
No nightshades. Okay. Any other?
The Mediterranean.
What's your show?
Mediterranean? Yes?
My three is I say no wheat, no dairy, no sugar.
Okay. No wheat, no dairy, no sugar.
That's my three.
No
So we're-
processed foods.
No processed foods. Okay. Anyone else that has an idea?
Blueberries,
Lots and
blackberries.
Low insulin diet,
What?
that doesn't cause an insulin spike.
A diet that will not cause an insulin spike, which would be being careful of your carbs. Yes, sir?
So blueberries, blackberries.
So you're bringing up antioxidants. This gentleman brings up you need to help stop the free radical damage of the knees, right? Okay, yeah, absolutely. So what an informed group here. Why did you come then to hear me? Anyway, so
That's
So-
what we're doing, it's not working.
there you go. All right, so is there a diet for people with arthritis? And I wrote the answer in this way. There are inflammatory reactions to food. This has been well established in the literature. So again, if you look at some of the things that make a significant difference, now we already talked about diet and weight loss, and that does involve a bit of a concept of a diet, doesn't it? Right? But in that subset there, they did find there are foods that bear in their consumption signals that interact with your saliva and the lining of your gut that will create damage to the lining of your gut from your mouth to your anus. And that lining of your gut will then react to the presence of the chemicals born in that food with a inflammatory localized response. So it's like a little tactical bomb going off, a little road bomb in that explodes along the lining of your gut. Because along the lining of your gut, isn't there a patch of material all lining the whole part of your stomach, from your mouth to your anus? You've got your adenoids, you've got your tonsils, you've got these gut-associated lymphoid patches all the way down to your anus, right? And what percent of your whole immune system is represented by this immune tissue lining from your sinuses all the way down to your gut?
90%.
Someone said 90%. Do I have another one? I don't think it's 90%. I've heard most commonly it's 80%. But I'm glad that you think more than less. So what is it in food? And this isn't a lecture about food lectins, but what is it in food that is identified as harming the lining of our gut? Does anyone know the name of that? Yes, lectins. We had one of the audience say a lectin. Lectin, L-E-C-T-I-N, lectins. For instance, if you heard someone said nightshades are aggravating to their joint pain, someone in the audience here. Nightshades are eggplants, bell peppers, red and green, potatoes,
Spinach.
and tomatoes. Okay?
Spinach.
No. So the nightshades are tomatoes, potatoes, eggplant, and the red and green bell peppers. And there is a common protein in the skins of these vegetables that when consumed, probably to some degree all of us, but there are certain of you very susceptible, okay, more than others, that will actually see a immune response, just like the achiness you feel when a flu bug, a virus gets in you. You know how your back starts aching you when a flu starts? You start feeling tired, and then your joints start aching you with a flu. So this invasion of this material of a virus that causes your immune system to try and attack it, isolate it, and make it eradicated from your body is similar to bringing in that food as you chew and digest it, these tiny fragments of the fruit and vegetables lining in their skin typically is where it's located, called a lectin, can along the lining of your gut create these little explosions and call for your immune system to react, all right? So you'll have a rash. Now, if you had a rash on your arm, if I had a rash all over me, it'd be hard to look at me, wouldn't it? You'd be like going, ooh, you know, right? But if I have a rash all down my gut, you can't see it. Mm-hmm. You don't know that I'm gassy. You don't know that I'm bloated. You don't know that I have intermittent loose bowel movements or very hard marbly movements, okay? Because you can't see the rash along my oral mucosa, esophagus, stomach, all the way down to my anus and colon, okay? But that's really what you would see on a microscopic scale at first. And then if you don't do anything about it and you think that's just who you are, you only have a bowel movement once every 4 days, or I've always had a loose stool and then an occasional firm stool all my life, I never knew that wasn't right, you know? I was always bloated, and I learned in my 20s not to touch milk or not to touch nightshades, you know, tomatoes. Then if you don't make a change, maybe you'll be that person at 39 or 42 that has a sudden bloody diarrhea explosion, right? Either ulcerative colitis, Crohn's disease. And then if the colonoscopist goes up and looks up your anus and your intestine there, then he'll see these obvious rashes along the inside of the tube of your colon, right? Right? If you get a CT scan, they'll see the obvious inflammation of the sausage of your small intestine. And here's a section that's thicker in the membrane of the small intestine. They'll just see, oh, it's obvious. That's how they can diagnose diverticulitis on a CT scan in the emergency room, okay? So these lectins are in everything, and they're aggravated, they're amplified, they're worsened if you are genetically modifying the food, because you're introducing to the diet of the American or any nation's population another genetic kink to that tiny molecular breakdown, aren't you? You're adding another challenge for your immune system to figure out. Are you all with me?
Yes.
All right, so another thing would be glyphosates, all right, or pesticides, or herbicides, or fungicides, right, that have been sprayed on it to keep the fungus and the bugs away for increased pound per acre sales for the profit of the industry. But when you consume it, if you don't wash it off, or if it's embedded, you can't wash it off, or they sometimes have these plastics on there. How many of you had an apple with the plastic you could see on the peel? Am I? Yeah, the wax. Yeah, the wax. All right, so these things inflame us and create these problems. And in the research of arthritides, in the research of rheumatoid or the inflammatory arthritides, it's very clear that there are groups of foods that amplify your gut immune response to their presence. And when it's amplified, that secondary casualty, collateral damage, you might say, is you can start injuring your joint. Because if you start inflaming this every day because you love your bell peppers in your Mexican food, every day you're eating your bell peppers in your Mexican food, and you don't know that your gas right now or your intermittent loose stool or your marbly stools are not normal until the day that there's enough damage, and then that immune system fighting along the gut lining here is now recruiting spaces on your joints the cartilage there, which is oftentimes referred to as a misidentification of your immune system against yourself to the membranes of your cartilage in your joints or your tendons or even your muscles or your thyroid, like Hashimoto's thyroiditis. But we're talking about arthritis right now. So the answer is yes. And when they do these meta-analyses and they look at foods, this is the number 2 well-established secondary, thing you can do to reduce the inflammation of your joints. So we have weight loss, and that's up to you. And then we have diet, or finding out what those foods are that are reacting to you, okay? And this goes across all the arthritis compared to all these varieties of wonderful, exciting, even total knee replacement or arthroscopy or meniscal repair or, surgical repair of a rotator cuff and joint pain, or the non-steroidal anti-inflammatories or cortisone or prednisone or injection of cortisone and other viscous injectables. It's compared to all that, weight loss is the number 1. And learning what you're reacting to in your foods. I'm throwing the responsibility on you, aren't I? Yes.
Another major cause of arthritis is misalignment of the skeletal structure. Like one shoulder higher or a little bit knock-kneed or bow-legged, or one hip is forward.
Yes.
And then the bones where they come together at the joint are not aligned properly, and it actually wears the cartilage. And so
Right.
there are exercises
That you
I don't
can
know
do.
if you've ever heard of a Goscue, but they
Yes.
actually photograph you and give you exercises that strengthen the muscles to pull the skeletal structure back into proper alignment.
Right.
And it's amazing. I've been doing it for 18 years. It actually changes the shape of your body.
All right. So there are planes
Right.
in our body that have to be honored. Okay. So if you can see this out here, so the plane of my ischial tuberosities here, you would see a line here, and it should be even. My shoulder shouldn't be like that, nor should I be like this, nor should I be like that, okay? And very often you'll have a doctor who you'll come in saying, my hip hurts, okay? My hip hurts. But in fact, what's going wrong is something in your gait, in your foot, in the way you're walking, okay? And how many of you have looked at your shoe? Here's your shoe at the back of it and the sole. And let's say you're wearing it off on one edge there, okay? So you're inverted with your walking. Do you see what I'm saying? And that discrepancy in the way you're taking your step is transmitted up into the knee and to the joint, and will create compensation. And so that's what this patient is saying. And this is where many of the wonderful doctors of chiropractic are very excellent in helping us. Your physiotherapists, your physical therapists as well, okay? So that is one of them. And I agree that's an important part. And things that they fix with that, but this was in the study as well. It was like putting in shoe inserts, working on your joint alignment and stuff like that. Compared to all these things, that didn't make the grade. It made a maybe, maybe not, maybe, maybe not. And then there's a whole group of things that are left in probably nots. And that's where they put a lot of things like acupuncture and capsaicin, hot red pepper treatments, enzymes, various things like that. Okay. So the answer to number 2 is there are inflammatory reactions to foods. And what do we do at the clinic here? How many of you have had an immunofood lab done? 1, 2, 3, 4, 5, 6. 6 out of 20.
Question.
How many of you had the food allergy test done at the lab, at my clinic? Yeah, about 6 out of your 27. All right. And in it, what they're doing is they look at about 150 foods and they make antibodies to those foods. And if they put your blood in that serum, okay, and your cells agglutinate, then they can say, wow, you have receptors for antibodies to that food, okay? And then you get a list of anywhere from, I've never seen anyone have none. And in general, anyone who has 10 or less is healthy, because I don't think there's a human gut walking out there in the 350 million in America who don't have some degree of a little irritation from your mouth to your anus, okay? We all have some irritation there. So we do this here at the clinic. I don't even know the price of it. I'm sure it's a few $100s. I'm not sure about insurance. I didn't go to medical school to learn billing and stuff. But it's a wonderful test. It's probably the oldest and most respected form of food allergy in the IgG, because how many of you know what an anaphylactoid reaction is? How many know what an IgE is? My nurses here know. Well, that's like if you eat a little peanut and then you start swelling up with hives and you can't breathe, right? That's an immediate, right away reaction, okay? That's an instant reaction, and that's IgE, okay? Everybody knows about that. That's what the EpiPen is for. That's what Benadryl is for, okay? That's what corticosteroids are for, to save your life. And then you learn, never get stung by a bee again, okay? Or don't ever eat a peanut again, or whatever it is. But that's a small part of the population, okay, in general, okay? But almost everyone has, well, and I would be bold, I'll say everyone has the IgG antibodies, okay? Immunoglobulins. And these are the ones to foods. It could be to lettuce will show up. I just had a patient today who said, I am amazed I have lettuce and I'm a vegetarian, you know, how can I have lettuce? And all lettuce means on the immunolab is that you have so many little leaky sieves. Instead of having nice solid tube, yours is spongy and inflamed, and the cell gaps have opened up so your food can leak through, even lettuce, all right? And I reassured her that she can heal just like everyone else, which will help her pain and her fatigue and joint pain. All right, so we need to do these food allergy tests, or we need to do an elimination test. And what we teach at Test and Longevity Center here is we ask you to give your immune system a break. How do we say, why do we say that? You're marketed to on the TV to wake up in the morning and have a breakfast that is commercially marketed to you as IHOP or Denny's or McDonald's breakfast, or right? There is a image already implanted smartly through marketing in our minds what a breakfast is, right? And the spices and the sausage and the orange juice and the bell peppers and the green peppers and the onions in your potato thingy bobber. I never eat that kind of stuff. So what do you call that? Hash browns? Hash browns, okay. But do you see what I'm saying? Look at all the work your gut is going to have to take on to figure out that's a bell pepper, that's a red bell pepper, that's the eggs coming down, that's the bacon, that's the nitrates in the bacon, that's the salt, that's the pepper, that's the casing on the, or porcine on the sausage, you know, on and on and on and on and on. You're going to have dozens and dozens of little things your immune system has to look out and say, check, safe, you may come in. No, stop, you're bad, dangerous, stay in the poop channel. Check, you come in. No, you stay in the poop channel, you know. And so you're this little army, all checking everything, has a tremendous thing to do. And you just keep on throwing food down there, throwing it down there, okay? You're marketed, okay? Your little phone goes beep, 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 and you see something. Someone take a picture of what they are eating. Oh, I wish I could eat that too. You know, right? So I need you to understand to simplify your diet. So we're going to ask you to eat a one menu day. A one menu day, what does that mean? It means if you eat breakfast, and we usually ask people not to eat breakfast anymore. We ask you not to eat breakfast because we're trying to narrow the hours that you're putting this system into use. So if you only eat a lunch, and then I turn on the machine here, right? And I only eat an early dinner and turning the machine on. If I eat the same thing at lunch that I have for dinner, the guys who are in my immune military system defending me, they're gonna go, check, we saw, that your roast chicken at lunch is coming down again. We got that handled. We know, we got this chicken handled, okay? We saw it earlier today. It's cool. And yep, we know what those green beans are, okay? We saw that at lunch, nothing new. We saw the same butter. We saw the same salt and pepper, okay? Do you see what I'm saying? I'm trying to narrow my spicy and choices into a one menu day so that I'm giving a break to the work of this tremendous 80% of my whole immune system. Calming it down. Make sense? Make sense?
Yeah.
Okay. Then tomorrow, when I wake up, I don't eat breakfast because I'm trying to give these guys more time off. They want, to rest and heal and repair what little areas of the gut that are inflamed, that rash. And there are nutrients that are in another separate lecture that help this. But if I wait until noon and I'm done eating by 6, I have 18 hours out of 24 that my gut has more time to heal, doesn't it? Right? Right?
Yes.
And what if I live my life like that every day? Isn't my gut going to have an easier time? Isn't it?
Yes.
It has to, okay? You sprain your ankle and the orthopedics doctor, you break it and you come to surgery and he does the wonderful skills and job the whole hospital brings to you to put those compound fractures back together again. And then he tells you with his mask on, surgery was successful, but you must obey me now for the next 6 weeks. You must not walk on that foot. How many of you are going to obey him? Yeah, you're going to obey him so you can walk again, right? But you come to me with pain and I say, for the next 6 weeks, you must not, should I be putting a mask on and scrubs and it's my white jacket? I wore all my regular stuff today. That's how serious this is. Do you understand? What I am telling you has in research more effective outcome than all these advanced things that they're doing. And I'm not saying don't do them, but I'm saying they are proven, okay? Now, another subset of the diet is the carb, the starch, the fruit sugar, okay? And how many of us here know Americans are overeating food? We have an obesity problem, right? How many of us know that we have a diabetes epidemic in the country?
Yes.
Yeah.
All right? And with diabetes, how many of us would agree that they get vascular damage sooner? Right? All diabetics get vascular damage quicker, faster, worser, if that's a word, okay? Right? Now, remember this little picture I showed you? Remember this little picture? And I was telling you about this very, 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 very special membrane in your joint. It's in your hip, it's in your knee, parts of your foot, your hand, your fingers, other areas. And this has a little teeny tiny strip of tissue called the synovial membrane, and it's rich in capillaries, right? And this is the filtration system that brings in nutrients to your joint and also removes damaging materials. It has in the membrane of the synovium fibroblasts that generate this wonderful fluid and certain proteins and so forth. And then it has macrophages in it, okay? So if it sees bad junk in your joint, is going to let those macrophages amplify and kill what's in your joint. Okay, and that's in this little synovium. All right, isn't that cool? Now, didn't I just say carbs, starch, and fruit sugar, right? How much diameter is there in one capillary? Do any of you know it? All right, let's draw a capillary. Here is a capillary, and we're going to say it is basically one cell membrane. It looks like a wedding ring. Okay, and that's looking directly down it. Do you see this thing here? It would be, if you could imagine, if my hand is one cell and it folds over on itself, that is a capillary. It doesn't have any smooth muscle. It can't constrict. It can't dilate, change flow. And it's extremely sensitive to any cytokine chemical in your body from those cells that are exploding from what you're eating. It's extremely sensitive to how much water you're drinking every day. It is extremely sensitive to how much sugar, bread, starch, pasta, bagel, grain, rice, beans, tortilla chip, fruit, nuts, seeds, cereal you're putting in your diet every day. Okay? One cell, folks. Now, what is the number? Let's put it in another color. The number of the diameter from here to here is about, at the best, 5 microns. 5 microns. Others say 2.5 microns. There's a tremendous amount of research in microcirculation today. Tremendous. How many of you heard of the BEMER? The BEMER mat. Okay. They are actually saying when the big arteries, here's, let's say, a big artery, then turns into a smaller artery, then into a little tinier artery, then into little capillaries, then you have the veins, the little venules, to a vein, to a bigger vein, to a bigger vessel, to bigger veins that have valves in them, right? And so, right. So in this area here, if I took one of my hairs and I pulled it out like this, and I sliced my hair 100 times to 200 times, one hair, the diameter of one hair, that's the thickness of a capillary. One cell and folded over itself. They're pretty tiny, huh? It's pretty teeny, weeny, tiny. Super tiny. Okay, let's have another sip of water. So I don't faint up here. And all my little capillaries help me think. All right, so do you think if you had a glass of orange juice, a bagel, and a banana for breakfast, that you would impact your little capillaries everywhere?
Yes.
Absolutely you will. Absolutely you will. Plus, you'll get hormonal impact, cytokine excitement, because every diabetic has vascular microcirculatory damage before any of us. And almost all of us are becoming diabetics now. We have an epidemic in diabetes emergence in this country. Folks, you got to drink your water. Who said water is one of the important things they found? It is. Okay, you got to drink your water. Folks, you got to cut down on your starch bread, pasta, bagel, rice, beans, tortilla chips, juices, cherries, berries, grapes, nuts, seeds. You got to reduce them all.
Why nuts and seeds?
Well, it depends. It'd be like saying, if I only had eggs and bacon at lunch and eggs and bacon at dinner, and I had a cup of seeds or nuts, then no problem. I'm probably under 20, 25 carbs a day, which is my personal goal. But if you lie to yourself, as most of us do, and you have grapes in the morning, oh, that can't be that bad. I heard apricots are good for you. You know, they're full of all that vitamin A. 4 apricots can't be bad. Dates, I'm constipated. I need a date or two, you know? The kind you eat, not you go out with. You know? And you see, you lie to yourself. And the rice, I just had a little bit of rice, okay? And I only had a few tortilla chips, okay? Plus, what are the big 6 foods that are in general? We talked about nightshades, but the big 6 foods are wheat, okay? And most doctors are starting to say, get away from the grains for the arthritis. Corn, and what are we eating a ton of down here? Tortilla chips, what are those patty things? Flaps. Isn't that a tortilla?
Yeah.
All right, huh? Pita, yeah, pitas, okay. And then, so we said wheat, corn, soy. You know, everyone's afraid of meat, and they're going to soy and tempeh and all that. Dairy, eggs. What am I forgetting?
Everything.
Yeah, I gotta drink more water and get my capillaries going, okay? Soy, wheat, corn, dairy, eggs.
Sugar.
No, it's a food item. Well, anyway, there's 6 big foods that are part of this. Peanuts came to me. That last sip of water made the difference, folks.
Legumes?
And you could say legumes, okay? Peanuts are a legume. By the way, cashews are legumes and pistachios are legumes. All right, so am I getting the point to you? Now let's go back to our beautiful picture of the synovium here. And you had a banana, a bagel, and a glass of orange juice. And you're worried about your knee bothering you. You know, most people by 55 in America, due to the obesity and everything, I see arthritis all the time. They could no longer, you know, wiggle and jiggle and so forth. That membrane is getting clogged up, folks. And that's the lungs and heart of your joint. That is literally what's bringing nutrition to your joint. Does it make sense now, folks? That's another reason why we do chelation in this place. Microcirculation was researched by Dr. Tony Lamas, and I believe he was the head principal investigator of the TAC trial to assess chelation therapy. That was a 10-year study, and it concluded in about 2014. At that time, they had somewhere around 1,708 men, all had a known heart attack, proven, all had standard of care. They were given a beta blocker, an ACE inhibitor like lisinopril, and they were given aspirin. If some got statins, and some got coronary artery bypass, the surgery. Some had the angiogram and stents put in, but they were all proven to have had a heart attack. Beta blockers is another typical standard of care. And then after the 10 years, and some of the men just got a hanging bag of water, and the other men were given a hanging bag with EDTA, the amino acid that improves microcirculation. When they unsealed it after 10 years, if there are 5 parameters, like if you've had a heart attack, your probability of having another one and dying is very significantly high. So risk of death is something we would want to watch, right? In a study, right? Number 2, getting more pain, angina. So it came back, oh, it's happening again, okay? And the severity driving you to a hospital, and so rehospitalization for unstable angina. That's another parameter they watch. Another one was getting their arteries reclogged in the stents, okay? That's very common after a stent placement, okay? What was the 4th thing? So there were 5 parameters.
That's when those at 8 o'clock.
Okay, and in those 5 parameters, the men who got the chelation had a 20% reduction in all-cause symptomology and mortality. 20%. Don't you think you'd be excited if a doctor had an 8% drug effect? You know it. You know they'd be popping the champagne and being excited over there, okay? And a subset of the guys who had a heart attack that had diabetes, which have much more vascular damage, right? And are much more likely to suffer the secondary heart attack or angina or reclotting. That subgroup not only improved 20%, it improved 40% from what that was predicted for their diabetic state of being. And it wasn't just a few of them, every parameter, the whole thing shifted. I published, okay? If you go to my website, tlcdoctors.com, you can see our publications. And if you look at our publications, we'll be looking at 2, 3, 4, 5, 6 parameters on something, you know? And if we see 3 of them improve, maybe 2 didn't, then we make a hypothesis or a conclusion that the change we were affecting and watching improved 3 out of 5 of the areas. And that's very common in science and research, is to see some of the areas you thought would benefit and some didn't. Got it? In this, every one of them improved. So when I talk about you come into my clinic and I want to stimulate your circulation, I want to improve the web-like angel hair circulation so your metabolism is revved up. You're burning more sugar per effort in the gym or on your walk or whatever you're doing. You're getting a better turnover of the starch or carbs or fruit sugars you do eat. I'm going to put you on chelation therapy for that membrane right there. Make sense now? Does it make sense? Yeah. All right. So thank God I only did 10 questions today. I'm going so slow. All right, the vast majority of patients suffering the pain of arthritis can help themselves by
Losing weight.
all right, losing weight. What else? So, diet. Yes. What else?
Exercise.
Water.
Yes, water. All right. So that was one of the significant factors that was valuable across the research retrospective meta-analysis. Number 4. How does the joint get its nutrition? You should all know that by now.
Synovial membrane. Synovial membrane.
Synovial membrane. And what's unique about the synovial membrane?
Capillaries.
It's got capillaries in it. And that's what delivers the oxygen and nutrients and protein and amino acids that are going to form your collagen and elastin and the hyaluronic collagen and all that kind of stuff. All right, excellent. So the joint gets its nutrition by having excellent microcirculation, right? Number 5, what do we lose with aging that helps reduce inflammation? What do we lose with aging that helps with inflammation?
Also,
The gentleman said muscle mass, and that's a true statement. 35 to 55, you lose about 0.5% of your muscle mass every year, unless you're doing something about it. 55 to 85, you're losing 1% per year, plus or minus, unless you're doing something about it. Okay, that's a lot of weight. And do people all get thinner from losing their muscle mass? No, we get heavier as we age, as a general rule. So what happened? There's more fat. You are a sharp audience, okay? All right, so there's such a thing as a thin fat person, and that's why we do in-body, analysis of your body composition. So let's go to that question. What else do we lose? Now, muscle is one thing, but that is not what I was getting at. What do we lose with aging that helps reduce inflammation?
Collagen.
Well, collagen, yes, our ability to repair and reform. And how would you get collagen into your joint? You have to have a capillary to get the amino acids there, don't you? You have to have fluid to do the remodeling, because do you think this muscle and mass here is the same arm that I had 10 years ago? It's not. You're always remodeling. Now the brain, much less, at a much slower rate. There's neuroplasticity today to a degree we never thought before. I knew it back then, but many are now agreeing you can even grow brain cells. What I'm getting at are enzymes. 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 The things that were first discovered in the early 1900s, in the 20th century. And they call these like the key of life. Enzymatic actions made things possible, okay? Enzymes helped reform material. Enzymes help digest material. So when you age, is your digestion getting better with every decade passing by?
No.
So what happened to you?
Getting worse.
It's getting worse. You're not digesting as well. All right. So when you go to an old folks home and they're in the little wheelchairs like that, and they bring their tray of food to them, do you see them eating up a nice steak, porterhouse steak?
No.
No.
Their teeth are probably bad too. Take out their teeth. Okay. What else? They want to eat the ice cream in the bowl there, and they want the applesauce and the Jell-O, don't they? They want all the easy to digest foods, which accelerates the clogging of their capillaries, their cognitive dysfunction. They're wasting away because they can't supply their muscles with all the capillaries needed everywhere. They can't for their eyes, and they die because they don't have enzymes to digest that steak anymore or the fat in it. All right. So what are one of the things that we do here at Tussle Longevity? Digestive enzymes, all right? So there are enzymes when you put food down in your stomach to eat. You're supposed to also follow that with some digestive enzymes to help chop it up so it's nicely presentable when, like during the standing. So if I eat a steak and it goes into my stomach here and I chop it up nicely, there's a hole here called the pylorus, which is the gateway into my intestines. And so that thing will not open. Will not open. Unless enough enzymes are secreted in to chop this up, kill the bugs, you know, because for all I know, when they brought me that steak, someone went, achoo, you know, sneezed all their slimy bugs on it, and they walked it through the restaurant and put it right in front of me. And I ate it. It was delicious. But, you know, do you see, this is happening to you all the time, folks. That's why God puts acid in your stomach. How low should the acid get for that little door to open? Your pylorus. How low?
Alkaline level.
It should get so low that it's almost more acidic than a Coca-Cola. Does anyone know what the pH of a Coca-Cola is? It's like a 2 or a 1.5. How many of you have gone in ambulance services, saw a bloody mess? All right, well, I did, okay. And we took Coca-Cola cans, and if there was blood all over the pavement or the sidewalks, we would just put Coca-Cola on it, and it would digest it away. Yeah. So in your stomach, you have to make enough acid, enough digestive enzymes to chop up your steak to help you get the proline, the glutamine, the cysteine, okay, amino acid particles to make your joints and everything, okay? To chop up that fat to make the membrane so that they're fluid, okay? Your phospholipids. Make sense? All right. So we give that for eating. Now, what if you're doing fine and you're digesting well, you're not backtracking? Just as an example, by the way, let's say you ate that food, it's 3 hours later, and I have to go tie my shoe, right? I have to bend over and tie my shoe. And if I have a lot of food in here, right, still chyme, the liquidy goopa in there, it's going to burp up the other valve into my esophagus. If I lay down after eating, it's going to burp up my esophagus because this has less pressure resistance than your pylorus, okay? So all this reflux we get with aging is also a feature that you're not emptying it down here as well, okay? So I take my digestive enzyme every time I eat. And as an aside, A-type blood people don't digest as well as a class feature. You know, it's not a judgment. B's have more allergies. always tend to get more arthritides of the osteoarthritic kind, okay? ABs are a mixture of the allergy and the maldigestion of the A's. So A's must start taking digestive enzymes when they're very young, very young. And I even see newborns that are A-type bloods that have that projectile vomiting. So think about it. Okay, that's just a freebie.
A plus or A negative?
It doesn't matter the RH type. It doesn't. It's just the A feature, okay, that we see. Now, systemic enzymes. Systemic enzymes are taken on an empty stomach. I take 6 every morning. So I'm loosey-goosey and I can do my workouts 5 times a week and, you know, I can just be on my job, okay? I take a systemic enzyme. How many have heard of Wolbenzyme? Wolbenzyme is an old, well-established German enzyme that has been used for joint inflammation, and it will reach into your joint. The enzyme will come in through this synovium, and it will be like a Pac-Man chewing up debris there. If you have a traumatic, you know, you sprain your knee and you get a little bleed in there, blood is absolutely horrible for joint health, okay?
How do you spell that?
Wolbenzyme, Wolbenzyme. But I don't use that anymore. I don't use Wolbenzyme. I think it's an inferior product. Instead, I go with Orthomolecular's Vascuzyme. And in it, there's years of research, efficaciousness, the lysing ability it has for both its components for fat digestion and proteolytic digestion. And so I use Vascuzyme and I use Vitalzyme in my clinic. Vitalzyme is the most powerful enzyme I've ever used in my clinic. And I use it anywhere from 3 once a day as a maintenance for everyone, or I go up to 40, 50 a day if you're trying to chew up a fibroid tumor or tumors, okay? But it's always taken on an empty stomach, so it's absorbed into your bloodstream and can get to your synovium and do the job we need it to do. Those are systemic enzymes.
You take about 6 a day.
I take 6 every morning,
Oh, at once?
all at once, kaboom. And I take it with my thyroid, and I take it, you know, with most of my vitamins in the morning. All right, next. So that was number 5. Number 6, what stabilizes our joint?
Tendon and ligaments,
Yes, and what else?
muscle.
Muscles. So the audience says tendon, ligaments, and our muscles. Now here's for all of us, not just men to exercise, ladies. If you aren't doing resistance exercise, resistance training, weight training, you're in trouble. You are withering, okay? You've got to do something pulling and pushing against a resistance, okay? No less than twice a week, no less, preferably 3 times a week for half an hour, okay? So that the tone of your, yes?
What if you have a fracture in your back? Can you still do it?
Well, that's a specific thing. How bad is a fracture and all that? How old is it? Is it stable, unstable? Now, that's what physical therapists, physiotherapy are for, and that's why I prescribe it, okay? But in general, before you break your back, before you break your hip, before you break anything, get your body out there and move it, man, okay? And I have to say, I would really like to see you doing it 4 or 5 times a week, okay? 4 or 5 times a week, 30 minutes, okay? And that, when the muscle is attached to a tendon that crosses over a joint, you're helping that joint to stay stable and have reaction. And when you're exercising, your balance is better, okay? You know, your proprioception is much better. And so you're less likely to fall, right? Tendons is just one ligamentous fibrous strand over to the other bone, okay? That's a ligament, okay? And then you have the joint capsule itself on your knees and stuff. But the totality of exercising my calf muscles, exercising my extensors, my flexors, my abductors, my adductors, you know, I do these kind of exercises too, so that I have a great mobility and stability, whether on my hips, my knees, my ankles, okay? You've got to do this, all right? Yes?
Along with their resistance, what is equally important is stretching.
Yes, one of the audience is saying, yes, warm up, okay? And I'll do about a 20, 30-minute aerobic warm up, okay? And that will heat up my muscles and improve the microcirculation to the synovium, okay? And then by stretching, you know, I can do much better, you know, doing everything that you do. Amen. Yes, you got to stretch.
Yeah.
There's a good book by Anderson that shows how to stretch, because there's a proper way and then there's an improper way. Stretching should never be done to the point where you feel pain.
Yes, yes.
No pain, no gain does not apply to stretching.
He's saying no pain, no gain is not right. Don't do that. You don't stretch until it's painful. You stretch till it's comfortable.
Correct.
And then you do it repetitiously, right?
And then there's the way to stretch, but just like what you're pointing out, this lady over here about the
Symmetry of the body.
symmetry.
Mm-hmm.
There's a symmetry to stretching also.
Yes,
You don't stretch against some symmetry.
yes, yeah. And you should balance that. Just like you should exercise both sides of your shoulder and everything, all the parts of the girdle of your hip. Yeah, and that's, you know, this topic, this is why it's fun, because we get to talk. And the more that we're doing this, we can go down other rabbit holes. Let me finish the last three. What can help reduce joint breakdown in our diets? So let's say you have a good knee, and let's say you have good capillaries in the synovium here, and you have not damaged the hyaline sheath of the ends of the bones. How do you protect them? Answers?
All the things we've talked about, especially GMOs, because nobody really has totally researched what they're doing to the gut lining.
Right. So she's saying everything we've talked about. Give her an A. Give that lady a ding, ding, ding. Essentially, you've got to move your body, exercise your body. You have to eat a diet that's not flooding your body with sugar, starch, clogging, sticky up all these capillaries and choking it of its nutrient and oxygen flow. You need your enzymes. You need to digest your food well, so you get the structural proline, glutamine, cysteine molecules that are so critical in your joint construction, your tendon construction, and your ligament construction. You have to drink enough water. And then the other thing with that we want to say is, let's say you're doing all that. What do you want? What am I doing? You know, I'm 65 and I almost never miss work, and I'm lifting and I'm moving knees every day and I'm doing that. Okay. I have to exercise, but I take antioxidants is what I'm getting at. You were bringing that up, sir, Mr. Isaacs. The antioxidants, blueberries, raspberries, but in fruits and vegetables, there's so much starchy sugar in many of these fruits and vegetables that we use the Juice Plus series is what we use, so we can get rid of that sugar. And then it has all the research of 42 peer-reviewed journals, and it has about 7 sports medicine review studies to show its efficacy in recovery time of the muscle and joint recovery, micro-trauma, immune enhancement, and things like that. So we talk about antioxidants. There's also collagen. And how many have been hearing about collagen? Should we take collagen? Yeah. And, you know, I am not going to naysay something at GNC or the vitamin shop, but in my medical practice, when you come to me, I have to have science behind what I'm looking at offering you, okay? You can come in with your product and say, I'm going to try this, and I'll say, I'll watch you, okay? But we have research collagen materials that actually have studies that go over years, 2 years, some 6 years, that actually show in 4 to 6 months, we see joint space expansion, which brings to a point, one of the things I thought very interesting in reviewing the literature for this meeting today, if you go in for a knee x-ray, they're going to put you in the x-ray suite and lay you down, right? Then they're going to bring the x-ray machine over your knee and go clink and get a picture of your knee, right? How many agree?
Yes.
Yes.
Yeah.
Well, that's not the way to take a picture of your knee. Okay, so a lot of the studies that are quoted in rheumatological and osteoarthritic orthopedic journals is referring to weight-bearing pictures of your knee. And there's bad people out there, okay? Not that I'm the perfect saint myself, but there are bad people out there, and there you are, and you're saying, I gave them collagen. And look at this x-ray 6 weeks later, 3 months later, and you see the joint space enhanced, okay? Between the two bones, hitting each other. Before one was touching, then you see them separated on the next picture. You know what that difference can be? Taking a picture of that same knee of him laying down, okay? And it's relaxed and the joint space is open. Then you stand the man up and you take a picture, pound per square inch. There is so much that you have to look in these studies. It hurts my brain to try and look at these studies. And did they control for water? Did they control for, the type of x-ray methodology? Did they control for this and this and that and so forth? So it's quite a challenge in science to get a consensus.
Wouldn't probiotics help that too?
What?
Probiotics help that too with the
Well, in chemistry and biochemistry, which, I've studied, everything helps everything, yes. Even your mood, even your I can do this mood, okay? So yes, probiotics create a disinflammatory state, a healthier state, and better serotonin, better, even vitamins from your own gut bacteria help feed your body. But I also put in there collagen, okay? Because we do have research that high quality collagen used over 4 to 6 months can show joint improvement, cartilaginous restoration. Now, this is before it's so broken down that your doctor has no other choice but to do replacement of the joint.
Excuse me, what about chondroitin and
Glucosamine and chondroitin sulfates. Well, sulfates and the amino acid components in these cartilaginous special amino acids help create the interlocking feature of the strand of your cartilage, the hyaline sheath of your knee cartilage. And by eating this, yes, it should be incorporated into when the trauma to your joint is not that bad. Now, there are those who will say, the old school orthopods will say, once you hurt your cartilage, there ain't no coming back from it. Now, how much of that is a financial drive, because they make more money if they can do an arthroscopy or a meniscectomy or then a joint replacement? And yet there's much research out there saying, yes, you can restore the joint and cartilage, okay? So it's out there, there's literature's there.
taking that?
Now, glucosamine and chondroitin sulfate of themselves, when you look at that big meta-analysis study I'm referring to, where they looked at all the way from acupuncture to knee replacement, it didn't meet the snuff or whatever that, it didn't get on the list of things that really make a difference. But again, in these studies, you have to ask, were they drinking enough water? Were they diabetics? Were they taking enzymes at the same time? What was their blood type? A doesn't do as well unless you give them enzymes. Then they do wonderful, So there are so many things in research that are not controlled for. You can pick apart any study. You can pick apart my studies, okay? So I'm in favor of chondroitin and glucosamine sulfate, okay? I am in favor of them because they're part of the very special type of amino acids of cartilage and ligamentous repair, all right? Okay. Number 8, can fasting reduce joint inflammation and breakdown?
Yes.
Yeah. And why do we say that? Because the longer your stomach is empty, the more it heals, the less it will be inflamed, the less inflammatory molecules will shoot out and be a part of this cascade that inflames your body. Number 9, what is ozone and PRP injections to the joints? What are they? PRP stands for Plasma-rich platelets, okay? And it is in the platelets taken out of the plasma that have a lot of growth factors in it, okay? And they can actually take your blood, spin it down, and then you have this buffy serum, the clear liquid on the top. And then there's a little line between the red cells, a little line there, and then the serum. And that area right there is chock full of platelets and growth factors and all these wonderful things. So we can actually suck that out and inject it right back into you. Well, how good is it?
How does it work? Painful.
Oh, it's not painful at all. Yeah, it's not painful at all. In the hands of a skilled person, I've injected countless joints. But the thing is, does it hit the snuff? And it didn't on that meta-analysis review. It didn't, okay? Nevertheless, in the studies that they criticized about it, it wasn't controlled for many of these features, that could have other impacts, a dehydrated person, a person who is a diabetic and so forth. A smoker would be an aggravating feature. Ozone, what is ozone injections? Ozone is oxygen, okay? Yeah, oxygen. And oxygen, anytime you cut yourself, okay? You don't go and say, oh, I need to think about it. Wait, don't bother me. I got to figure out how to heal this cut, right? You don't go there, oh, come on, edge. You meet to the other edge. Come on. You can do it. You don't do that, do you? Your skin, unless you need sutures, okay. I was an ER doctor, sewed up enough. But in general, you get a cut, it's going to heal up, isn't it? All right. And you don't need rocket science on your part. Just ignore it. Clean it, put a Band-Aid on it, and a week later, there's skin, a scab, and it's healing, right? So what we're saying is the oxygen that is exposed to your cut is one of the biggest signal triggers to start a healing process that doesn't involve all the risk of your blood and spinning it down and the goobers that are in your blood, okay? All right? So oxygen has been long used in injection therapies to put it in the joint, pure oxygen. You won't get infected. You can never say it won't, but 99.9999, I've never had an infection. And it stimulates healing, okay? Oxygen is a clear-cut value, ozone therapy, all right? And then the last question. Is the research on joint space repair with collagen, vitamin C, magnesium, hyaluronic acid, glucosamine sulfate, chondroitin sulfate, amino acids, proteins, is there good research? And the answer is yes. The answer is yes. And we didn't cover all these. I will say one of the four was the Symvisc, which is hyaluronic acid injected in the joints. If you want to say out of the dozens and dozens of interventional therapies from the rheumatidities to the osteoarthritides, and you say, did Symvisc hyaluronic acid work? The answer is yes. It showed up showing a real value, So getting hyaluronic injections in is a positive for me.
Is that just a staying for a while and then you have to do it again and then again?
Well, corticosteroids are typically 3 to 4 times a year maximum because they themselves can create some joint damage and secondary problems of themselves. Symvisc seems to have none of those risks, okay? And so you can put an injection in and it might be a year or two before they'll need another injection. It might be 6 months. But the absolute long-term, and what is the real-time corticosteroid injection? And usually we'll mix it with a little lidocaine or procaine when we put in some, corticosteroid. 4 weeks, honestly, okay? And Symvisc is clearly months worth of value, months, okay? So yes, there are wonderful and deep areas that we can go into through here. The amino acids, we've actually shown with Perfect Amino Acids, a research brand of human essential amino acids. Now the bottle on Perfect Amino Acids says take 5 a day. the research amongst alternative doctors is 10 a day, and you can actually see muscle mass developing and poundage taken from that. So I use a perfect amino so that my joints, on all my workouts that I do all the time. What else can I say? Any other questions?
Perfect amino, do you sell that here?
Mm-hmm.
Is the synthesis, is that made from bird feathers?
There are various producers, and there are groups that don't use avian sources, yes. So you have to find out who the producer is, and Symbisk does not, in my understanding, if I'm remembering right. Did I drink enough water for the capillary up there? I want to ask, what do you want next month to talk about? What do you want to interact on next month? Shoot out some topics.
Is CBD oil really what it's checked out to be?
All right, CBD. And the answer to that is yes, and that's useful in joint pain. It is. Any other topics that you would like to address? Huh?
Endometriosis?
Endometriosis, interesting. Any other topics?
Neurological,
Alzheimer's, dementia?
yeah,
Okay.
Parkinson's.
All right, so we have neurodegenerative diseases. We have endometriosis, female problems, polycystic ovaries. And the other one was CBD. Yes,
And Lyme disease?
Lyme.
You had just mentioned Procaine.
What?
Procaine.
Procaine, yeah.
You give Procaine in this office?
I'm not doing it anymore, okay? I was doing ozone injections. I'm not doing it right now.
Because there was a doctor in Romania, Dr. Aslan, and you know the doctor.
Neural
She
therapy.
do Procaine.
Yeah, it's really
And
good.
Winston Churchill used to take.
Yes, neural therapy. It's a whole research out of Germany. It's
And
fantastic.
I heard that amazing.
Yeah, it is amazing. It's resetting the neurons in a group, in a nerve bundle. So I want to say it's time to end. We like to start on time, end on time. And I want to thank you for your participation. And I want to thank you for your advanced knowledge. I'm really impressed with a lot of you with your good answers. And so until the second Thursday in August is what date, Blake?
August 8th, I believe.
August 8th. Could someone check your phone on that? And then to the internet people, were there any questions there?
There were not.
There were not. Okay, so good. Very good. Thank you. Good night.
So, if I like to take those Procaine shots, would you be able to do it?
I really would